Have you ever wondered why some days your erections feel strong and steady, and other days they seem weaker, slower, or almost unpredictable? And have you ever quietly asked yourself whether your masturbation habits could be part of the reason? You're not alone. Thousands of men ask me the same question in my clinic. Not because they're doing something wrong, but because no one ever explained how the brain, the nerves, and the hormonal system respond to repeated stimulation. So today, I want to talk to you directly. Not to judge you, not to scare you, but to give you one simple, science backed way to understand your own sexual rhythm. It's called the 20-20-20-90 rule, and once you hear it, you'll probably recognize patterns in your own body immediately. This rule can help you understand why erections sometimes fade during masturbation, why sensitivity can drop after repeated sessions, why recovery time changes with age, stress, and lifestyle, and why your brain plays a bigger role in arousal than most people realize. If you've ever felt anxious, confused, or frustrated about your erection quality, I want you to breathe for a moment. Most of the time, this isn't a sign of damage or disease. It's a normal biological response, and when you understand it, you can take control again. By the end of this video, you'll know exactly how the 20-20-20-90 pattern works, what it tells you about your sexual health, and how to use it to support stronger, more confident erections. Let's start by understanding why this even happens. When men first notice changes in their erections, the mind often jumps to the worst conclusion. You start wondering if something is wrong with you. You might even feel a quiet sense of embarrassment, especially if it happens during a moment when you expected your body to respond differently. But here's the truth I remind my patients of every day. Your erection quality is not just about your penis. It's a reflection of your brain, your hormones, your nerves, your stress levels, and your habits. And masturbation is one of those habits that interacts with all of these systems at once. Think about the days when you feel mentally drained, stressed, or tired. Have you noticed how arousal feels different during those times? Or how your body takes longer to wake up sexually after a period of repeated stimulation? These changes aren't failures. They're signals. Your body is trying to communicate its energy level, its recovery needs, and its focus. But most men never hear this message clearly because they've been taught that sexual performance should be automatic, that erections should just happen on command, that desire should stay the same every day, no matter what life throws at you. That's simply not how biology works. Your sexual system is cyclical, responsive, and sensitive. And masturbation can influence that cycle because it affects dopamine, nitric oxide, testosterone rhythms, and sensory nerves in real time. So when erection quality shifts, even slightly, it can create confusion. You start asking yourself, is this normal? Did I overdo it? Is this the beginning of ED? These questions often lead to unnecessary anxiety, which ironically makes erections even harder to maintain. That's why I want to introduce the 20-20-20-90 rule. It gives you a simple, understandable way to interpret these natural fluctuations. No shame, no fear, just clarity. Once you see how your body cycles through stimulation and recovery, things make much more sense and you regain control. Now let's break down the 20-20-20-90 rule so you can finally understand what your body is doing during stimulation, after stimulation, and during recovery. This rule helps you track your natural erection rhythm, your sensitivity levels, and your brain's changing response to arousal. It's simple, practical, and supported by what we know about hormones, nerve signaling, dopamine cycling, and refractory periods. Keycap 1 first. The 20 seconds, your arousal on switch, the first 20 seconds of stimulation tell you more about your erection health than most people realize. When you begin touching yourself or engaging with erotic thoughts, your brain sends rapid signals through the spinal cord to increase blood flow into the penis. This is the on switch. During this early window, you're assessing how fast your arousal rises, how quickly your erection begins. How sensitive you feel if this response feels slower on certain days. Don't panic. Your arousal startup speed changes with stress, sleep, anxiety, hydration, and even how distracted you are. Men often worry when the start feels inconsistent. But variation is normal. Your body isn't a machine. It's responding to the moment you're in. The key idea is this: Your first 20 seconds show your current mental and physical readiness. They're a snapshot, not a diagnosis. Keycap 2 second, the 20 minutes, your peak sexual window, the next part of the rule refers to the 20-minute sexual performance window. This is the period where your erection stabilizes, sensitivity sets in, and your nervous system is fully activated. During this window, dopamine peaks, nitric oxide maintains blood flow, breathing deepens, focus sharpens. Touch becomes more pleasurable, but here's the important part. This window shortens or lengthens depending on how often you masturbate, how stressed you are, and how rested your brain feels. If you've masturbated several times in a day, your peak window might be shorter. If it's been a while since any sexual activity, the window may feel longer, more intense, or more sensitive. And that's completely normal. A lot of men think they should perform the same way every time. But your body is balancing hormones, nerve sensitivity, and psychological energy. Performance fluctuates because your internal environment does. The 20-minute rule helps you understand what your natural peak feels like today, not yesterday, not last week, but right now. Keycap 3/3, the 20 hours, your biological recalibration period. This is the part most men have never heard about. After ejaculation, your brain enters a 20-hour recalibration phase. And this applies whether the ejaculation happens alone or with a partner. During this period, dopamine levels temporarily drop, prolactin rises, testosterone briefly shifts, nerve sensitivity reduces, sexual focus naturally dips, your body enters a calming, recovery-oriented mode. This doesn't mean you can't get aroused again within 20 hours. Many men can, but the quality of your arousal may be different. You might notice a weaker erection, lower sensitivity, slower arousal response, a more wandering mind, more friction needed for stimulation. These aren't signs of ED. They're signs that your body is recalibrating. I tell my patients, your brain isn't rejecting arousal, it's simply resting. And this is where anxiety can show up. You may expect your body to perform again quickly, but biologically, your system is still resetting. When you understand the 20-hour recalibration, you stop misinterpreting normal biology as a problem. Keycap 4 finally, the 90 days, your sexual rhythm reset. The last part of the rule is the 90-day cycle. Your sexual system follows a longer biological rhythm influenced by testosterone fluctuations, stress patterns, sleep quality, overall health, emotional energy, masturbation frequency, porn, exposure habits. Every 90 days, your sensitivity, desire, erection strength, and recovery time shift slightly. These patterns are subtle, but when you pay attention, you'll notice them. For example, a man feeling supercharged may be in a high testosterone phase. A man feeling less sensitive may be in a recalibration period. A man with high stress may see temporary dips in erection stability. A man who changes his masturbation habits may feel different levels of control. Nothing is wrong. Your body is cycling, adapting, and rebalancing. This 90-day rhythm explains why erection strength can vary across months without any underlying disease. It also explains why lifestyle changes, better sleep, reduced stress, cleaner diet, more movement, often take weeks to show sexual benefits. Think of this cycle like seasons. Your sexual system needs time, space, and consistency to shift into a new state. So, what do you do with all this? Use the 20-20-20-90 rule as a personal guide. The first 20 seconds tell you your readiness, the 20-minute window tells you your peak performance, the 20-hour period shows your recovery pattern, the 90-day cycle reveals your long-term rhythm. When you understand these natural rhythms, you stop blaming yourself. You start listening to your body with patience instead of pressure. Now that you understand the 20-20-20-90 rule, I want to bring everything together in a calm and simple way. Because the real value of this framework isn't in memorizing numbers. It's in learning how to interpret the signals your body sends you every day. Your sexual health is not random. It's not a mystery. And it's certainly not something you need to feel anxious or ashamed about. Your body follows patterns because your hormones, your nerves, and your brain chemistry follow patterns too. When you recognize these rhythms, you take back a sense of control and confidence. The first 20 seconds help you understand your immediate readiness. It's like checking your emotional and physical weather before you start. Some days are sunny. Some days are cloudy. Both are normal. Neither defines your masculinity. The 20-minute window shows you how your peak performance changes with stress, sleep, frequency, and focus. When you stop expecting yourself to perform the same way every single time, your mind relaxes and erections often become stronger. The 20-hour recovery phase reminds you that your nervous system needs rest just like your muscles do. Sensitivity dips. Arousal slows. Your body resets. This is not ED. This is biology working exactly as it should. And the 90-day cycle shows that sexual health is part of a much bigger rhythm. Your long-term stress levels, mood, lifestyle habits, and overall energy shape the quality of your erections over months, not minutes. When you make small improvements, your body responds gradually and sustainably. So here's what I want you to remember. Erections change. Sensitivity changes. Desire changes. Every man goes through these cycles, whether they talk about it or not. There is nothing wrong with you for noticing fluctuations. In fact, it means your body is paying attention. Your sexual system is responsive, adaptable, and trying to balance itself. Always listen to your body. When it needs rest, give it rest. When it needs stimulation, approach it without pressure. You're allowed to be patient with yourself. Confidence grows when you understand your biology and treat it with respect and kindness. You're not broken. You're human. And your body is doing exactly what it's designed to do. If this explanation helped you understand your body a little better, I'm really glad. My goal is always to give you clear, science-based guidance without fear or judgment, because sexual health should feel understandable, not stressful. If you'd like more videos that break down topics like erections, hormones, energy, confidence, and long-term diabetic health in simple, practical language, make sure you subscribe to the channel. It helps you stay informed, and it lets me keep bringing you doctor-led guidance you can trust. And if you have a question you've been carrying quietly, something you've never asked anyone, you're welcome to share it in the comments. You're not alone, and you deserve answers that make sense. Thank you for spending this time with me today. Take care of your health, your energy, and your peace. I'll see you in the next video.